Thank you. I'm going to give a bit of an overview of Meducation and just a bit of an update, what's new in the last 18 months, the last time I was in front of this audience. And then I'm going to give a quick demonstration also of what's new with Meducation. So, okay. So first off, the reason for Meducation really is this issue of low health literacy in our patient population. How many of you received, and something looks very similar to that thing on the right-hand side there, when you've received a prescription at the pharmacy, or when you came out of the hospital, or left your doctor's office? What'd you do with it? Right in the garbage with the rest of the packaging. And the reason we do that is because it's not engaging, okay? It's also, we're all well-educated people here. The average American reads at the 7th grade reading level, okay? This is almost always written at college reading levels. Small font, almost always in English. Think of your mom. Think of most of the elderly population. Think of our limited English proficient patients. This doesn't help them. So those are the issues we're trying to resolve with Meducation. So we're trying to make everything in a patient's medication instructions easy to understand. So we make extensive use of research-based best practices like the Universal Medication Schedule, which is 4 dosing times a day. We make extensive use of pictograms. All of the instructions are written at a 5th to 8th grade reading level. They're dynamically created in any of 24 languages. 1 line per instruction, lots of white space where we can, to reduce the cognitive overload and make it engaging. And by the way, this is dynamically created. You can see these are very patient-specific instructions. These are not static leaflets. We're trying to go beyond patient education to patient activation. This is what we want you to do with your medications, okay? It's not machine translation. It's a massive library of phrases that we assemble in real time based on those patient-specific instructions for use. In addition to those individual instruction sheets, perhaps the most important piece that we do is this calendar you see in the middle. This now for health institutions that have licensed Meducation, this replaces their med list in their discharge instructions from the hospital for Athena, Epic, Cerner, eClinicalWorks, and McKesson Paragon, and Allscripts Sunrise are all of our FHIR integrations so far. So there's kind of those 3 elements of Meducation: the calendar, which is about improving medication adherence, the instruction sheets about reducing medication errors, and then there's a small library of videos that talk about proper medication administration techniques. Oops. All right. What's new is that we now write back into the patient record. So with Cerner, we use the document, for the first part, which I showed you earlier, we use medication order and medication statement resources to pull the information out of the EHR. And now with Cerner, for example, we use the document reference resource to write the document back into the patient record. And then from there, it can be automatically made part of that package of instructions. So reducing, really minimizing and streamlining the workflow. And then, of course, once it's been written back, of course, it can be made available for the patient to view from the portal. So we have that integration now with Cerner, Epic, Paragon, and Meditech. We haven't done that piece with our other Smart on FHIR integrations with Sunrise, and I can do this, Athena, and eClinicalWorks. So we're still working on those last three EHR integrations. In terms of the impact we can have, this was a study done at the San Francisco General Hospital. The control group were counseled using materials from a very old EHR, admittedly, and the Meducation group were counseled using the Meducation materials. And this was the difference in their 30-day readmission rate. There's a lot of other studies on Meducation, but this is the closest I can get to us actually having an impact on health outcomes, which is what we're getting to. The fact they read it and understand it and adhere are great things, but it's the actual impact on their health outcomes that is our end game. But if you see a faint line down between, so summary of some of the results of Meducation. The San Francisco General Hospital study, University of Connecticut had impact on HCAHPS, and the VA had a great study that showed tremendous impact on medication adherence. But what's different now is if you look at all of the logos there, the ones on the left-hand side, turn that around, the ones on the left-hand side some of those cost me sometimes tens of thousands of dollars to do customized integrations with those organizations. Or they end up having to use Meducation as a standalone web service. But the column of logos on the right-hand side, 37 hospitals at Dignity Health. Every single patient that is discharged from any one of those 37 hospitals receives Meducation instructions in their discharge instruction package, okay, automatically. And then you can go down, you can see that, you know, our reference customers from McKesson Paragon, Allscripts Sunrise. I don't have Athena up there, or eClinical Works. We don't have reference customers there yet. And you can see a couple of Epic customers there. So what's different from now and 18 months ago is just the progress that we've made on this. I mean, a year ago it was just one EHR that we were able to integrate and get live customers up and running. And now we're up to 6. And, you know, I'm very optimistic about that number growing substantially over the next few months. Now I'm going to jump into the demo, because traditionally Meducation has been a provider-facing application. So you invoke Meducation from within your EHR workflow. In case of Epic and Cerner, it's a button in the discharge workflow. For Paragon, Sunrise, ECW, etc., it's from a menu of FHIR apps. Not quite as clean in workflow, but getting there. So I'm going to now switch to the demo mode. So first I'll demonstrate Meducation in the provider workflow. So you click that button in the discharge workflow in Epic or Cerner, or from a menu on the left-hand side in the other EHRs. In Sunrise, it's a tab across the top. And what that does is use the medication order and medication statement resources to send the med list. You saw briefly there, that little thing briefly said processing med list. That was them sending the data elements we need, which are drug code and the patient-specific instructions, some people call the Sig instructions, to Meducation. Meducation then returns this healthcare provider UI. Let me just make that a little bit bigger. So you see, this is the patient's med list, their Sig instructions. We have a very sophisticated Sig recognition engine. I've seen over 1,400 ways people can say take 1 pill a day. Sig recognition is one of the big challenges we have. But with it, so this is kind of the user interface. From here, you can, you know, pull up individual instruction sheets. Oh, let me change that back to English. Hang on, English. You can pull up individual instruction sheets for bedside counseling with a patient. Go over the, you know, how to take it, the key instructions, cautions, side effects, etc. You can toggle the language. If you've got an Arabic patient, you can toggle it as easily as that to Arabic. If they're elderly, you can raise the font size to up to 18-point font. You can also show them the videos from here and things like that. But what most organizations do, really after MedRec and prior to discharge, is click the calendar button, which gives them a preview of what the patient's going to see in their discharge instructions. You can, oops, don't do that to me, sorry. I pushed the wrong button, excuse me. All right, go to the calendar view. I was just trying to make it smaller so you could see the whole thing. And so you can, it's an editable interface. If SIGs aren't recognized, you can clarify them. You can specify specific times of day. You can add auxiliary instructions. It really depends on the user. Pharmacists are more comfortable doing those things, nurses less. You know, we've got to cater to all users. What you normally do though here is just select your language. I'll just do English for now. Select your font, and then click, we don't actually click print, you click save, which saves the documents back to the patient record where they're automatically made part of the discharge instruction package to the patient. But for this audience, I'll show you what those instructions look like. So there's your calendar. You imagine they post that on their fridge or their medicine cabinet, you know, that's really kind of an adherence tool. And then you can scroll down and see the individual instruction sheets for each of the medications. If you want to do that in another language, you simply select the other language, I don't know, and print that calendar again. Come on. Okay, there we are, in this case Mandarin. And when you scroll down, now your video is accessed by that QR code is now in Mandarin, as are all the rest of your instructions. Okay? So that's the traditional way in which we access Meducation. So this is what's coming. The idea that you could Right? The idea that you could go to a tab on your patient portal, okay, so I'm going to log into Bay West Health. And if you recall with Meaningful Use 3, there's a provision now that patients need to be able to get their healthcare data. Their healthcare providers need to provide them their healthcare data and be able to view it in the application of their choice. I can't remember the exact wording, but this is what we're trying to get to. And it's not for meaningful use. Meaningful use does not get me out of bed in the morning. But the idea that a patient could actually use these apps, because paper isn't appropriate for everybody. Everyone has to use it different ways. But the idea that a patient could access their medication information. So here is Raul Garcia logging into his patient portal at Bay West Health, I think it is. We've got a little work to do with the UI and our work with Cerner, but we can find our Meducation button down there. And this is not him accessing his information via the portal. This is Raul, come on. This is Raul, sorry, I love doing live demos. In any case, this is Raul asking his healthcare provider to send his medical data to this third-party app called Meducation. So his healthcare provider requires authorization, provides that authorization, and that sends Raul's information to Meducation. So he's in control of his data now. And we'll be working on the user interface, but basically from here he can get to his individual instruction sheets. He can put them in Portuguese because that's his language. Let me raise the font there so you can see a little better. But he can, and if his daughter, got her records, and you saw that he had a choice of looking up his records versus his daughter Cassie. If his daughter got her records in English, he wants to see them in Portuguese or whatever, he can go there, he can toggle the languages, he can watch the videos, he can, generate his calendar in whatever language format he wants. So that's Raul with control over his data. The other thing that we can do is have an app on the App Store. Again, we're still working on the user interface. We actually launched the user interface earlier this week. I just haven't got it in demo format yet. But in any case, but I'll show you how this technically works. So you click the app on your smartphone, and then you select your healthcare provider from a drop-down menu. So you could select your healthcare provider. It might be Duke Health, it might be Yale New Haven Health, any of those logos you saw on the last sheet there. You select your healthcare provider and request your med list from that healthcare provider. And you can select multiple ones. So you might have your PCP, your hospital, whatever. And I might just click that twice. I might have messed this up, but in any case, just a second. Come on. And what that does is request that healthcare provider send my medical data to this third-party app called Meducation, and then Meducation will return their material. So they're going to ask me for my prove who I am. Yes, it's the same test patient, Nancy Smart. Prove who I am. Ask for explicit authorization to send my materials. Okay. It'll then send those medication lists from those multiple providers. I can do a little patient specific med rec. I can delete a couple things that I'm not taking anymore. Import those meds. UI does need some work, don't worry. Import those meds into Meducation, and then from here I can generate my calendar. I can do it in whatever language I want, but then I have my calendar, and it's me controlling my medication data or my medical data, requesting it from healthcare providers, having them send it to an app, and then returning it to me in a consumer-friendly medication app that will look a lot better than I demoed here, but I wanted to show that it was possible. That's it. And that's what I have. Thank you all very much.